Good afternoon. Welcome to another live session. Did you all miss us for 2 days? Unfortunately, those 2 days we were not really able to be in front of you because there was some personal things as I've mentioned. So how are you all? What did you do for the past 2 days? Were you all, what can you say, um, studying? Or did you all relax? What did you do? What did you do? Tell me. So I am Vinod James. Welcome to another live session with me with Neethu's Academy reading. Okay, as students are getting in, really looking forward to welcome a lot of students. So the most important thing whenever we do, what can you say, um, live, what are the things that we definitely look into? The most beautiful thing about coming in front of you. See, the most, what can you say, fruitful thing to come in front of you is every day. We come and meet a lot of new students as well. So, is there anybody who's attending for the very first time? If so, please do let me know also. A lot of good evening, Pramita, Amita, good hi. Liba, good afternoon. Amita, good afternoon. Ashwati, good afternoon. Jita, good afternoon. Bessie Binoy, good afternoon. Jean Maria, good afternoon. Madhusmita Bera, good afternoon. Liz Mary, good afternoon. Alina Royce, good afternoon. A lot of known names as well as a lot of new names as well. Soji Renji, good afternoon. So tell me, what are you all up to? Or what were you all up to for the past 2 days? None of you have commented saying, what did you do for the past 2 days? Krishnendu, good afternoon. Sarika, good afternoon. Jay Arya, good afternoon. Anu Anil, good afternoon. Rosmi Anthony, good afternoon. Yes, what did you all do? Janet Leslie, good afternoon. ആരെങ്കിലും ഉണ്ടോ attending for the very first time? Lekha Baiju, good afternoon. Anybody who's attending this live session for the very first time? Because we have a lot of students who share the very same link. Okay, that's how the support that they render to us. Lydia, good afternoon. So Maria Matthew, good afternoon. So when those students share, the most important thing for them to know also is because of their share, there are a lot of students who are attending first time as well. So anybody's name, if I've forgotten to read, it's not deliberate, okay? Reggie Lal, good afternoon. Bindu Shinoj, good afternoon. Libya Abbais, first time. Thank you very much, Libya. Would you be kind enough to tell me where are you from? Maya Suresh, good afternoon. Other where no just to add on to my what can you say, known people's list. I can say I have known people across different parts. Okay, excellent. Rosmi Anthony, first time. Raj Nirmala, first time. So people who are first time, welcome to Neethu's Academy live. Okay, would be very happy to know where are you all from, because just to show the number of students who are there in front, that the class that you're attending is a multi-diverse class. Dubai, okay, I know more people now from Dubai. Excellent. So see, people from Dubai, people from Saudi, people from Middle East, different parts of Middle East, okay, people from India, different parts of India, people, Annette, okay, first time, okay, very nice. Am I really happy to know that there are a lot of students who are saying, that courage to come and say, I am here for the very first time. Excellent. So we have people from Nepal, we have people from Israel, we have people from Raj Nirmala, Tamil Nadu. Okay, fair enough. We have people from Australia, New Zealand, UK, Ireland, you name the country, Africa, South Africa. We have people across. So you are sitting in a class where it is multi-diverse. And it's again Saudi. See, as I've mentioned, there are lots of students from Saudi as well. Excellent. So thank you very much for letting us know. Yeah, that's the most lovely part of doing a live. You are in front of a students gathering who are from different parts of the world. Isn't it stunning? Isn't it? Veena Borrell, good afternoon. Excellent. So that's the most beauty of the when you come into the live session is that diversity. Okay, known people, not so familiar people, and purely first time entry people. Excellent. So I know that you would have heard a lot about Neethus Academy. See, what do we Neethus Academy do, or Neethus family do for all of you? We have regular batches available, but the next batch, as you can see on the screen, it is available only from August, September, October. Till that time, the students have trusted us. They are ready to wait in order to get into Soumya Shijo. Good afternoon. And then we have crash courses available. If you want any insights about all these courses, please do get in touch with our admin. The numbers are posted on the screen. Okay, now why we are telling you over and over again is, see, there are a lot of fraudulent people available. See, today also there is another fraudulent group which is there saying that join their group so that they can get exclusive Neethus Academy material. I don't know why these people do that. It's easy, to cheat. These are all people who are there literally just to cheat other people's money. Okay, so please be cautious about such kind of cheaters. Those people are there, isn't it? The world has a mix of good people and these kind of leeches who literally rip other people's money. Okay, see, please understand, we does not, so we do not have any other groups apart from two Telegram. Okay, one is an official Neethus Academy page, and the other one is a Neethus Academy exclusive reading page. We do not have any other groups. So please do not fall for these kind of people who are just trying to rip somebody else's hard-earned money. Okay. Generally, the students are very wise. They do not fall for it, but there are some students who unknowingly get into that trap. So that is why again and again I'm stressing this very important one. Because we are trying to avoid such kind of fraudulent people. But of course, these people have no other work, isn't it? They will simply come up saying a lot of different things. So if you get any information, if you are being contacted by any other people, okay, saying that this is Neethus Academy, this is that, do not respond to it. Please understand, we will not message you. We will not ask you to call. We will not ask you to do anything. Okay. If you want, you can call in those two numbers that is there on the screen. There you have the numbers on the screen. If you have any doubts with regards to any such thing, please do contact that number and clarify it. Understood? We will not contact you. So that is one important aspect to find out who was right and who was wrong. Am I clear? Understood? So do not fall for this, because today there is another thing. See, we are trying to ban these people. We know. See, you can also do the same. When you find that these people are contacting you, even now with the very same page that you're watching, they will contact you. We try to avoid all those people by removing, but you can also block them. Understand? So that they don't disturb you. These are people who are just for something else, no purpose at all. What can you say? Leeches, isn't it? Absolutely feeding on somebody else's blood. No standard, no backbone is what I would definitely Okay. See, there is again, we will go into right. So what we will do is we'll go into the part B and part A. That is all what we will be doing it. Again, there is a small technical glitch. That is what again we were trying to rectify. We just had. I don't know what is happening. Okay. So the question will be coming on the screen. Okay, but I would not be able to show you where exactly. So what I will do is I will just read it out for you and you can do whatever the answers is. Just find the answer. Okay. So the question once it pops up, just do find the answer. There you have the question. Just find the answer and then we will discuss. Okay, time have just exhausted, isn't it? It just goes very quickly. Renu, thank you very much for that lovely message. Hi, I reached my dream country last week of April. Thanks for your support. It's always our pleasure to hear that all of you are acquiring or achieving your dreams. So do enjoy, have a blast in your dream country. Okay. And this is definitely another boost for all people who are right in front of me, who also would feel that, yes, I will go and make my dream a reality. Isn't it? So, yes, as what Renu said, all of you would also be telling that to us one day that you all have made that dream a reality. Isn't it? Excellent. I'm sure that all of you would. Now, can you all tell me what is the answer to the question and where you got the answer? That is very important, okay? Because part B is more of understanding the gist. So we need to know where exactly you have found the answer and what is your answer. Would you be all kind enough to tell me what is your answer and where you got the answer? There are a lot of new names, okay, which I'm quite happy today. But unfortunately, we're not able to give you the fullest of what we definitely was trying to give you. But of course, we'll make the most out of it, isn't it? Now tell me, what are your answers for that part B question? Tell me whether it is A, whether it is B, or whether it is C. The question will come onto your screen right now. Okay, that we will discuss it. But before that, can you all tell me what is your answer? I just want to know what Sita. Good afternoon. So if I missed all your lovely names of wishing, I'm very sorry because lots of messages do keep on popping, so I was not able to follow it. Right, so tell me, what is your answer? So part B, how we will do is, you have to read the question, very important. See, there are people who always come up with these kind of messages. Yeah, please do avoid those kind of people as well. Anu Anil is saying B. Jean Maria B from first para. Malu Joseph B. Arya Rahul B. Manju Merita B. Maria B. Liba B. Pramita B. Madhusmita B. Asit Bhakto B. Anita B. Priya M B. Excellent. So all of you saying B. Prince B. See, I want all of you to comment. Okay, do not refrain yourself. Okay, see, whatever is your answer, do comment. Just because that all of them are saying B, it is not necessary that the answer should be B also. Okay, Maya Suresh B. Excellent. I definitely expect all of you to comment. Why? Because you are here to learn, isn't it? So we need to make sure that what is the purpose of it? The question is also asking the purpose, isn't it? Jinsi B, Rosely B, excellent. Now, what are the things that we need to do? Vismaya Nair B, excellent. So it's a very unanimous decision, is it? B, okay, fair enough. Now, what are the things that you have to really look for when you're doing part B? The main thing that we are going to do when we're doing part B. For part B, when it comes after taking part A material, they'll give you part B and C together. So once the part B comes, read the question, understand the keywords in the question. So the question is clearly saying the purpose of these notes about counseling agents is. So purpose, that means the overall idea, that means the overall gist about this note is for what? With regards to counseling agent. So option A, to aid and advise patients, caretakers at home. So is it advising the patient's caretaker at home? Or B, to consider various aspects while treating a patient. So consider various aspects, treating patient. So treating patient is not there. So first one, aid and advise, caretaker. Consider various aspects. Option C, modify himself as patient's case. So somebody to be modified. Now after doing this, you're going to go to the paragraph. Counseling, a service to society. Counselors advise and assess individuals, families, groups, and organizations. The American Counseling Association describes counseling as a collaborative effort between counselors and their clients. So very specifically, it is talking about what is counselors, what are their purpose. To be an effective counselor, a trained professional needs to be able to work on numerous levels. For example, counselors help people of all ages identify problems, strengths, and goals, work through issues, improve interpersonal and coping skills, address mental health concerns, change behavior, and focus personal growth. So these are the things that is been done as a counselor. So various aspects, isn't it? So definitely it is aiding into B. Often when one person is seeing a counselor, the effect goes beyond what the individual gains. So families and family dynamics are affected when someone who has been grappling with difficult problems begins work with a trained counselor. So whatever the issues that he's having, he's going to work with the trained counselor. As the individual client learns what is causing her distress and how to manage it, family members open to evolving may benefit from knowledge, understanding, and improvement acquired through counseling sessions. So these are the benefits again. Other beneficiaries include extended family, employers, colleagues, friends, community groups, and society. Now let's go into the best and the most appropriate way of finding the answers, elimination. As you would read, you should do that, but I'm just saying how it is. To aid and advise patient's caretaker at home, nowhere it is mentioned in the paragraph, isn't it? It is to aid. The whole purpose of this note was to not eliminated. Now modify himself as a patient, that is also not mentioned. So very straight answer, as what you have unanimously said. The answer is B. Throughout the paragraph, it is to consider various aspects while treating a patient. What should be done? What are the benefits of it? Okay, so a very straight answer. So that wraps up part B, which is the answer is B. So any doubts with regards to any of the options or anything that you want me to clarify further? Is there anything? No, all of you are clear with that. Right, now let's go into the next one. What is the next one? We are going to talk about part A. So all of you have the printout? Yes? I'm sure all of you would have the printout. Right. Now, without going in or wasting most of your valuable time, let's go into part A. As again, due to some technical glitch, I'm not able to share the screen. So I hope all of you have your printout. So skimming and scanning is one thing that you have to do in part A. So you are expected to skim 1 to 2 minutes. That's it. 15 seconds the maximum per text. So we go through what is today's topic. It is plasmapheresis. Okay, that's how the pronunciation goes, like plasmapheresis. Right. How was the material? Next question. Was it easy? And we have always taken into account, because procedures we are trying to give you different materials we have taken into account, we will be addressing it. Okay. How was the material? Ashwati is saying clear. Okay, excellent. How was the material? Tell me. Or how was it? Easy? Okay. Fair enough. Neethu Miss is giving you easy materials. It's not because that it is easy. It's about how that attitude of changed when you're doing it. Okay. Excellent though. As long as you are finding it easy, we are very happy. Rajimol Praveen, good one. Okay. Vidya, clear. Okay, fair enough. So are you all ready for me firing 20 answers for part A? Yes? Anu, easy material. Okay. Let's go into part A. Question number 1. When does the procedure undertake a lengthy session? So my question keyword is when. Very easy question. Why? When is needed, isn't it? When is important. When lengthy session. That's the most important keywords for me. Now, where do we get that? So if you really look into, when you have skimmed it, you would have skimmed it in text B. If you really look into the final paragraph of text B, the treatment frequency can vary widely from condition to condition and also depend on overall health. So a lengthy session, undertake a lengthy session, and all those things are mentioned. Can last 1 or 3. You may need 5 treatments per week. Treatment frequency and all those things vary in text B. Good enough. Question number 2. How plasma exchange differ plasma donation? So do you really need to worry about where exactly it is? Because if you would have underlined it, there is only one place where you have underlined plasma exchange, plasma donation. Where is that? A. Isn't it? Just A. Why? It is clearly mentioning in the second paragraph, they're talking about plasma exchange, and then the very next one is talking about plasma donation. That's as easy as it is. So question number 3. What measures to be taken if patient is diagnosed with the onset of thymoma or thymoma? So onset is a very beautiful word, and it is one prominent word which keeps on coming every time in your material. Onset means beginning, start. So where are they talking about? Measures to be taken. Onset. If early onset of thymoma, where are they mentioning thymoma? It is mentioned in D. So the answer to the question is D. Refer keywords. Okay, that is the easiest way to find the answer. Question 4. Category that shouldn't be advised for plasmapheresis. So category shouldn't. That's a very important keyword. So where are they talking about? They're talking about that in text C. Why? Plasmapheresis may not be appropriate treatment for some people. Who are those? The three list of people are mentioned. So the answer is C. Range of disorders that can be addressed by performing plasmapheresis. So range of disorders. What are the disorders that they can address? So all those range of disorders are mentioned can be used to treat a variety of autoimmune disorders. So all those disorders are mentioned where? In A. Question number 6. How often an individual can donate plasma? So often, how often? Again, a frequency. Plasma. Where are they talking about all these plasma and all? It is as such mentioned in text B. It clearly says a person can donate plasma up to twice a week. So the answer is B. Question number 7. What are the negative impacts of plasma substitution? So negative impact, that means there is some problem with plasma. So what is the problem? The problems are mentioned where? In text C. This is a typical reaction to the solution used to replace plasma. So that is the problem mentioned. So the answer is C. Next, 8 to 14, I have told you it is short answer question. You have to by heart the answers, how you write the answer option. Word, number, combination of both, or a short phrase. Reading the question, underlining the keywords are again mandatory. The maximum number of treatments required by a patient per week. So maximum number. Just we read that before, isn't it? So you may need 5 treatments per week. So what is the maximum number? 5. Excellent. Question 9. What would undergo a decrease as a side effect of plasmapheresis? So something which is undergoing a decrease as side effect. So what is a decrease? It is mentioned in text C. It is clearly saying usually they are rare and generally mild. The most common symptom is drop in blood pressure. This is often accompanied by. So the most often one is, what is a decrease? Blood pressure decreases. Good enough. It's a 2-word answer. BLOOD PRESSURE is the answer. Question 10. What might be done upon the early diagnosis if it is not producing sufficient effect? So early diagnosis, that means just, where are we talking about early diagnosis? It is all mentioned throughout D. So what should be done? What might be done? Re-evaluation of diagnosis should be done. So the answer is re-evaluation. RE-EVALUATION is the answer. Question number 11. Specific diet recommended for patients should be rich with. So something that in that special diet, it should be rich with what? So they are clearly saying where? It should be rich with protein in text B. Where is that? Eat a diet high in protein and low in phosphorus. So our question keyword is what? Rich. Rich means high. So it is protein. Excellent. Question number 12. The process that would highly resemble plasmapheresis. So which process it is similar to? It is very similar to where? It is mentioned in text A. Second paragraph, last line. This process is similar to kidney dialysis. So what is it similar to? Kidney dialysis. KIDNEY DIALYSIS. Excellent. Question 13. Clotting, a serious but uncommon side effect of plasmapheresis, is caused by. So clotting, a serious but uncommon. So where are they talking about all these? So they are clearly saying blood clotting. What is it saying? Underneath that, more serious but uncommon risk includes bleeding, which results from Anti-clotting medication more likely. See, there is a small thing, isn't it? That clotting, instead of clotting, it should be bleeding. Okay? That clotting is a typo error. Because why we gave you that typo error is, at times, these kind of mistakes does happen in the exam. Okay? So the answer is anti-clotting medication. Yeah, ANTI hyphen CLOTTING medications. Okay. I know why when you said 13 is a problem. There's a typo error. We know that. Question 14. Which drug must be substituted if the required effect is not received? So a drug that should be substituted. So where are they talking about drug substitute? Replace azithromycin. So A is at ATHIOPRINE. Why? With another immunosuppressant drug. So what is it being replaced? Which drug is replaced? Is it azathiopurine? Azathiopurine. A is at ATHIOPRINE. Now question 15 to 20 are called fill in the blanks question. Again, same instruction. You have to be very cautious. Question 15. People who are allergic to dash are not suitable to become the candidates of plasmapheresis. So allergic, where are they talking about all these allergic and all those? They are clearly mentioned in text C, isn't it? What are the people categorized? They are saying heparin. HEPARIN. Question 16. It is with the solutions of dash or dash which is used as substitution of plasma in the blood. So where are they talking about all these? It's in the very first paragraph, text A. It clearly says saline or albumin. SALINE ALBUMIN. Question number 17. Our dash is being attacked by the antibodies that are present in our plasma during sickness. So our dash, which is, you know, that it should be there, just to see whether it is mentioned in the paragraph. It is there in second paragraph text A. If you're sick, your plasma can contain antibodies that attack the immune system. It's a two-word answer. IMMUNESYSTEM. Question 18. And dash may be advised by the professional to prevent blood clotting that may develop from plasmapheresis. So what is to be advised? Your doctor may prescribe an anticoagulant to help reduce your risk for blood clots. So what is that? It's a hyphenated word. So please ensure that you are writing with hyphen anti, A-N-T-I hyphen C-O-A-G-U-L-A-N-T. Okay, Liba, see, in the paragraph it is mentioned as hyphen, with the hyphen. So please ensure that you are replicating as mentioned. Question 19. The arm to which the needle is inserted is being selected according to the availability of the most dash. So how was the arm selected? So where is it talking about? It is there in text B, the big paragraph. Okay. During the plasmapheresis donation, you will rest on a cloth, then the needle or a catheter will be placed into your vein in the crux of whichever arm has the most robust artery. So it's a two-word answer, ROBUSTARTERY. Rajimol, if you have written most robust artery, your answer is wrong. Why? Most is already mentioned in the question. The ultimate question today. Dash is the initial drug administered following the confirmation of the diagnosis and can be resumed until control of symptoms are achieved. So keywords: initial drug, confirmation, diagnosis. Where are they talking about all these? It is there in D. Okay, if you really look into the third, where acetylcholinesterase inhibitor and thymectomy. Very good symptom control. Yes. If it is yes, what are you doing? Continue with acetylcholinesterase inhibitor. So ACETYLCHOLINESTERASE inhibitor. INHIBITOR. So I have fired my 20 answers. If you have any doubts, please do clarify, or else please do let me know what is your total score. Acetylcholinesterase. inhibitor should be there, yeah, because inhibitor is not there in the question. 18, Jean Maria, excellent, good enough. Pramita 19, excellent, good enough, good enough. Saumya 19, excellent, good, good, good. How about others? Any doubts? If you have, please do. Jinsi 19, excellent, good enough, good enough. Pramita is also dancing, excellent, good enough. Saumya, thank you for the flowers. Good, good, good. Saumya Anthony, 17, good enough. Rajimol, 18. See, I want you to start telling in front of public, you should be able to say, yeah, I got this. Whether it is 1 out of 20, whether it is 20 out of 20. That is where your courage should be. Anu Anil 18, Liba Libin 18, Ashwati 18, excellent, good enough. Arya 19, excellent, good enough. Yamini 17, good, good, good. Keep it up. And the most beautiful thing, yesterday's results been published. Have you all seen? Manju Merita 18, excellent, good enough. Lekha 17, Missy 18, Linia Mole 18, excellent. Saumya 20, 14, absolutely good enough, miss. That should be the decider because you have taken that big step of telling what is your score. See, for all those students who have cleared yesterday, heartfelt congratulations from all of us from Neethus. Okay, it is because of your hard work. And it's always nice to see all those students who have made that dream a reality, and all of them scored tremendous marks. Have you all seen those gorgeous students who have cleared, who made that dream a reality? Did you all see? See, please do start telling yourself, I will also come one day and say, I have cleared my exam. I have got my passport ready. With the Sajan 18. So because there is no doubts and all happening, okay? So I'll be seeing you tomorrow. We will definitely try to make sure that all the things are rectified. We're doing our level best. So once again, sorry for the inconvenience caused. Until I see you tomorrow, adios from all of us from Neethus family. Take care. God bless you.